The announcement on Tuesday by the Australian Health Minister of a temporary ban on new child patients accessing transgender hormone therapies has sparked considerable controversy. This decision, halting access to puberty blockers and other such therapies, has drawn immediate and sharp criticism from medical professionals and advocacy groups. The Queensland branch head of the Australian Medical Association, AMA, vehemently argued that the government must prioritise the expert opinions of medical practitioners over what they termed ideological views. This statement underscores a deep rift between the government's approach and the medical community's perspective on the appropriateness and safety of these treatments for transgender youth. The Cairns and Hinterland Health and Hospital Service, in an attempt to clarify the situation, issued a statement emphasizing that a recent review identified process issues within the clinic responsible for administering these therapies. Crucially, however, the statement explicitly stated that no evidence of patient harm had been discovered during the review. This distinction is vital, highlighting the government's focus on procedural irregularities rather than any demonstrable instances of negative patient outcomes directly attributable to the therapies themselves. The lack of documented harm raises serious questions about the justification for the ban, especially considering the potential detrimental impact on the mental and physical well-being of transgender children. Dr. Portia Pridnai, the Vice President of the Australian Professional Association for Trans Health APATH, expressed profound disappointment and shock at the government's decision in an interview with ABC Radio National on Wednesday. Dr. Pridnai pointed out the long-standing and established use of puberty blockers, not solely in the context of gender-affirming care, but also in the treatment of conditions such as precocious puberty and endometriosis. This highlights the broader medical application of these medications, further underlining the incongruity of targeting their use specifically within the realm of transgender healthcare. Dr. Pridnai's statement forcefully emphasized the extensive evidence base supporting the safety, efficacy, and reversibility of these medications. She directly challenged the assertions regarding the safety concerns, highlighting that these concerns are exclusively raised in the context of gender-affirming care, not in their other established medical applications. This discrepancy suggests a possible bias or misunderstanding regarding the established medical uses and efficacy of these therapies. The AMA's Queensland branch echoed these concerns, demanding that the government base its decisions on scientific evidence and the collective expertise of medical professionals rather than unsubstantiated ideological considerations. The implications of this ban extend far beyond procedural issues. They encompass the fundamental right of transgender children to access appropriate and evidence-based health care. The debate now centers on the ethical and medical considerations, with the government's decision facing intense scrutiny from medical experts and advocates alike. The lack of documented harm coupled with the established medical applications of these therapies raises serious questions about the government's justification for this temporary ban and its potential impact on the well-being of vulnerable young people. The ongoing discussion underscores the urgent need for informed and evidence-based policy decisions in the field of transgender healthcare. The government's actions will undoubtedly face continued challenge and debate within the medical community and the broader public sphere. The long-term consequences of this decision remain to be seen, but the immediate impact is a significant restriction on access to potentially life-altering medical care for transgender children.